Hey, everybody. Good afternoon to those in the eastern part of the country, and good morning for those in the West Coast and Hawaii and Alaska. This is our latest webinar um, from the National Wraparound Implementation Center and the Wraparound Evaluation and Research Team. We're going to give folks 2 minutes to get in the room, and in the meantime, we always really like it when folks put a little bit about themselves in the chat. Our national community of wraparound practice is wide and deep and a beautiful thing. So it's neat when people get to introduce themselves to each other. So feel free to put in the chat who you are and where you're from, what organization or initiative you're representing, and where in the country or the world you're in, and we will have that for folks to look at while we get ready to get started. So thanks for doing that. It's nice to see so many familiar faces when we do this. So welcome to Illinois, Maine. I mean, it's just so cool to see the way our community of practice just spans the whole country. So of course, we have UConn, University of Connecticut folks, including those we'll be introducing in a moment, our NWIC coaches and trainers. But we have folks who are affiliated with so many different states: Maine, Idaho, Illinois, Texas, Humboldt County, Oklahoma, San Bernardino, Orange County. We got a few Californians in the house. I hope things are okay for you. We know that you're going through a very difficult time in Southern California. It is just awful, awful images we're seeing. Everybody's going to need some kind of wraparound down there because it is just a terrible, terrible thing. We've got Portland, Oregon. We've got Utah, Virginia, my home state. We've got Presley Ridge, my adopted home state in Maryland. Colorado. It's good to see you, Mona. So we know that Colorado is one of our newest National Wraparound Implementation Center partners. Florida, Texas, Indiana, Maine. More Florida, more Oregon, Texas, Michigan. This is incredible. Kentucky and New Jersey and West Virginia. Thanks to everyone for putting a little bit about yourselves. We're going to start in 1 minute here. And I'll go ahead and introduce myself as I'm scrolling through all of our friends and collaborators here. So I'm Eric Bruns. I'm from the University of Washington, although in Seattle, although right now I'm just in the department of my backyard, in my office here with all of the things on my walls behind me. Hello, Nebraska, more Colorado, more Nebraska, and right here in Spokane, Washington. Thanks to everybody for joining. So again, I'm Eric Bruns and I am also the principal investigator of the Wraparound Evaluation and Research Team here at the University of Washington. And we serve as the accountability and data lead for the National Wraparound Implementation Center. And with Janet Walker, co-lead the National Wraparound Initiative. And maybe I'll just let a couple of people who are going to be contributing chime in, and that is Kim Coviello and Kim Eastep. You want to introduce yourselves real quick?
Sure. Hello, everyone. We're so excited to have you here today. I am Kim Eastep. I am with the Innovations Institute at the University of Connecticut School of Social Work, and I put on a lot of hats. Director for System Design and Implementation Strategies, as well as the National Wraparound Implementation Center. So it's good to see you all. Kobe.
Yes, and good afternoon, everyone. It is so nice to see so many friendly faces out there, or at least names. My name is Kim Coviello. I am the Assistant Director for the National Wraparound Implementation Center, located at UConn School of Social Work within the Innovations Institute. And I am also happy to be here for our first webinar of 2025.
And let's also meet the rest of the Wraparound Evaluation and Research team, all of whom had something to do with this presentation today, because this is the team that we're a lean team right now. We got 6 folks, 5 including myself. So Jonathan Olson, Senior Research Scientist, after a year sabbatical at UConn, is back with the WERT team. Jade Richards, our Research Manager. Kristen Vick, just have to give out special props to Chris, who cleaned thousands and thousands of data points for this analysis. Katie Renteria is one of our WrapStat and WAFIS tool specialists, and Rosa Peterson's the newest member of our team. She's our research assistant, recently graduated from the University of Washington, and she's been amazing. So thanks to everybody, and also thanks to you all. Here's a map, actually updated to add a couple of new National Wraparound Implementation Center, collaborating states. But those who use the measures of the Wraparound Fidelity Assessment System are from 60 unique states and large jurisdictions across the United States and hundreds of sites. And so you can see we cover just about all of the country. The dark purple states are statewide WAFIS tool users, our Wraparound Fidelity Assessment System, and the lavender states are those that where we have at least one collaborator. And then all of those turtles, those are states current and past where the National Wraparound Implementation Center has done intensive training and coaching and technical assistance. So this is really, these data are all thanks to your hard work as well. So today what we're going to do, got to warn you, if you aren't used to these webinars, there's going to be a lot of data. We're going to be looking at an updated, very, very first analysis of 1,300 data points from the Document Assessment and Review tool. Got to really thank Jonathan Olson, our Senior Research Scientist, for doing that. We're going to look at 4,400 caregiver surveys from the Wraparound Fidelity Index, which are surveys of caregivers, youth, care coordinators. We're just going to look at the caregiver data because there's just too much data to do much more than that. And then we're going to hear from Kim and Covey about things they're seeing that align with what they're doing out there in the field. And you all should feel free to put questions into the chat. We got lots of folks monitoring it who will interject when they see a good question. There's going to be a lot of data, so rest assured we're going to have the slides and we are going to have the recording available at the website of the National Wraparound Initiative, as we do for all of our webinars. And so you will see that announcement. If you're not already on the National Wraparound Initiative listserv to get our newsletter and these kinds of announcements and data and so forth, please, if someone could put the website for the National Wraparound Initiative and where the webinars are maintained, that would be great. Someone can do that. The other thing we're going to probably be doing is you're going to see that we've got just a whole lot of really rich data, and it's going to be the basis for some communications from the WERT team, the Wraparound Evaluation and Research team, where we try to, we'll be putting up on our brand new website, which is going to be launched in a week or two, some updated benchmarks for the DART soon, because we have those data now, and also other data from this presentation. So all of this will be followed up by lots of resources that hopefully will be useful for you. All right, so quick background. For those of you who might be new to all of this, the Wraparound Fidelity Assessment System tools are what we're going to be looking at data from here today. And we're going to be asking, what are we learning or what are we seeing in terms of trends in wraparound implementation across the country? And our tools that we use to help track implementation quality and outcomes for wraparound care coordination is Wraparound Fidelity Index short form, or WFI-EZ, surveys of families and professionals about wraparound adherence. We have the team observation measure, which we're not going to show any data for today, but is a second measure. And then our newest and perhaps most, the measure we're most excited about, and you'll see why in just a minute, the wraparound DART, document assessment and review tool. And that's only been around in terms of our fidelity tools a relatively shorter time, maybe only 5 or 6 years as opposed to 10 plus for the other two tools. So we're going to be looking at these data. And the other thing, you'll hear a lot of people talking about WrapStat. If you are a collaborator, a licensee of those tools, one or more of those fidelity tools, you also get access to WrapStat. And it's thanks to WrapStat that we have all of these data available for ourselves to look at across all of your initiatives and states. But it's also helps you collect data from the TOM, DART, and WFI, and allows you then on the other end to be able to download raw data sets, to run reports of different types to help manage your initiative or your program. It also helps you know just how complete your data are. So it will monitor what % of all of the families you've sent surveys from the WFI-EZ actually have returned them. And that's really important to get good response rates that are representative of your whole community. So it does things like that as well to keep you on track with collecting the data. And then finally, WrapStat allows you to enter information about the outcomes that your young people and families are achieving. But as we'll see in this presentation, folks aren't taking much advantage of that yet. And we really need to encourage folks to, not just for your own purposes, so you know what the most important things are, whether they're happening or not, which is that young people are being kept at home, in school, and out of trouble. And then we, selfishly, here at the university can use all of those data much more effectively to ask what actually matters to outcomes. So WrapStat helps us do all of those things. Again, promote rigorous data collection by allowing you to randomly sample from your youth roster, help track your response rates. Again, it does give you a chance to evaluate some very, very basic but critical outcomes for your wraparound youth, like how long they've been enrolled, what the reason for discharge is, was it successful or not, and then those community outcomes. And then last, it also helps us be able to take all those data and make sense of them for the field, which is what we're going to do today. Okay, so let's break up my talking and talking a little bit. Let's launch a poll. Brittany from the University of Connecticut Innovations Institute is helping us here. So first off, tell us about your people here, 189 folks. It's incredible. Which measure or measures of the Wraparound Fidelity Assessment System does your initiative use? Do you use the WFI-EZ surveys? Do you use the team observation measures? Are you using the DART? And I'm looking at the data coming in. Looks like 85+% use at least one of these tools. Looks like the Wraparound Fidelity Index is the most common. That's not surprising. But what's really cool here is we're seeing more and more folks using the DART, which we think is probably the most objective tool to use, because it allows a reviewer to look at all of the EHR or paper files and on their own time really code out very exactingly what kind of adherence you're seeing to wraparound in the documentation. So look at that, 64% with the WFI. So about 2/3 are using the WFI, 1/3 are using the TOM, 1/4 are using the DART. Only 16% of y'all, maybe 25%, some folks have no idea, which is fine. Glad to have you. Aren't using any of the tools. So we've got a whole lot of, oh, maybe this wasn't being shown. So we have got, and I'm seeing a great comment. The WFI is hard and long. Yeah, it's true. It is very, very, it's a long tool. When it was created 12+ years ago, it was pretty typical. We're trying to move to easier systems for collecting data, as we'll talk about. So I think people have seen that. Did people see the results? And if so, then we'll go to our next poll. So how long has your initiative or organization used one or more fidelity measures from our system. Just really kind of curious. Some folks are already saying, man, it's been too long to even count the years. I get that. We have a lot of really long time collaborators, which is so cool. This is very, very, it's like it's very even here. We've got the majority of folks, actually people are spread out all across. We got about a quarter saying they've used them less than 5 years, about a quarter saying 5 to 10 years, and about maybe 30% looking like 10 plus years that you all have used the tools. So we've got a whole bunch of folks who are very familiar with the Wraparound Fidelity Assessment System tools. There are a lot of other tools out there that are critically important on outcomes. You know, I'm seeing the Ohio scales, critical to also collect data on outcomes. Just wondering how fluent folks here are with our fidelity tools. It looks like a lot of folks who have used a lot of tools for a long time. So my guess is that you all will be really interested to see what we find from all your data. Okay, so I assume that that's been shared with folks. I don't know if I have to click a button or not about that. I can't see.
No, it's already shared.
Okay, thank you so much, Brittany. All right, so we got a lot of really folks who are experienced with these data. Again, I'm just going to be putting a fire hose out there of data, and then we're going to let Kim and Kobe talk a little bit about what they're seeing out there in the world. And we are going to make this available. You can download the slide deck, but there's going to be a whole lot more communication about what we're learning from these tools and a whole lot more work on our end. So let's start with some very first learnings from the DART. So very cool to see that almost a quarter of folks here have got the DART being used in your initiative or state. We have not had data until now to really look at some things that establish how well the DART is working. We've got some really cool results. So we're going to look at reliability and validity of the DART. We're going to look at results from across the items and the key elements of the DART. And what does it look like the field is having the hardest time, or what are strengths and needs for improvement? And we're also going to see some really interesting findings about DART fidelity and outcomes. So for those of you who don't know the DART, it assesses fidelity. This is something that can both be conceived of as harder or easier, depending on how you're looking at it, to use than our other fidelity measures. So you don't have to be at a team meeting. You don't have to get a hold of families. So those things might make it easier. It does take a couple of hours to do a DART, and that's even after you've done it for some time and been trained on it. But what you do as a DART reviewer is you look at all of the paperwork, quote unquote, or all the documentation, whether you keep it in paper form or in EHR or a data system. So you're looking at the referral information, the strengths, need, culture discovery, family story, progress notes, team meeting notes, team attendance logs, outcome measures. So you take a look at all of these different pieces of documentation. It's a challenging process, but you can do it, well after a family's discharged if you have access to all the documentation. So it can really be a very, very useful summary of how things are going if you have access to these documentation. And what we've learned is if you just, if you have hundreds of youth you're serving, and you do a good random sample of just 20 of those youth, where you really are looking at 20 representative young people and families' records, you can get a really good sense as to things that you're doing well and that you can improve upon. So DART's been a very encouraging thing. The sections of the DART itself include background information about the youth and the referral reasons, and then the things that we score refer to the engagement, the timeliness of engagement, mostly in the first 2 phases of wraparound. So engagement and planning phases, how quickly do we get through the critical steps of wraparound? Then you have the key elements. So that's the fidelity section, section E, the longest, and we're going to dive deep into those items in the fidelity key element section. Then we also look at the adequacy of safety planning, crisis response, transition planning. And one thing that's really cool about the DART is it has a systematic way of asking whether positive outcomes were achieved for each youth that you look at. So we have analyzed almost 1,300 darts from 7 states, and these were completed by a diverse set of raters. So when the National Wraparound Implementation Center is doing intensive training and coaching and technical assistance, we find a way to make sure that they have an evaluation plan for their fidelity in your adherence to the wraparound principles. That happens differently in different places. So in some places, the state that we work with has asked the WERT team to do document reviews and score the DART. But more common, in some places, innovation staff do it. More commonly, evaluators or even coaches in the states that are using the DART are the ones who are completing it. And there is a training toolkit for folks so that if you license the use of the DART, you have some materials you can use. We're trying to improve those because people tell us that the training materials are too hard. Got to find something easier so you're not being thrown in the deep end with these sample records that we give folks to practice on. But anyways, there's ways for folks to do it locally, and that's all of those folks are thrown into this mix of darts that we've analyzed. So we have a long way to go to learn about, some things, but we're getting started here now. 7 states, 1,300 darts. I'm just going to go straight to a really exciting finding from the DART. So across those 7 states, there were 2 very important unique states. One was a state that is often referred to as one of the real gold standards for statewide wraparound implementation. They've been doing it using care management entities. They're doing it statewide. They have policies and funding that really support wraparound. Some of you probably know the state or could guess. I'm not going to say what it is, but that's the established state. And you can see in that lavender bars, this well-established, well-supported statewide wraparound initiative, those that have used the DART in organizations and care management entities in that state have achieved far higher fidelity scores than our comparison. So again, of those 7 states, we have that really well-established state. We also have a state that is working with NWIC and is brand new, and they used the DART for dozens of youth from their at baseline before starting with NWIC on doing high fidelity wraparound. So they represent a brand new state. And then we have this in the lavender bars, an established state. And you can see when you start seeing that a tool can differentiate really well-established evidence-based practice from one that's just getting started and it hasn't even really been attempted yet, then you have a really good feeling about your fidelity tool because it seems to be able to distinguish those kinds of conditions. And so that was something we learned right off from our DART analyses. Another thing that we learned, big picture, is that for all of the DART subscales, safety planning, the fidelity elements, being outcomes-based, needs-based, natural community supports, driven by strengths and families, and timely engagement. When the fidelity was better, when we had better DART scores, we also saw that those families experienced more positive outcomes. So the way that John Olson did this, Dr. Olson, is that he broke our DARTs into 2 different categories. One for families where staying at home, in school, out of trouble, improving on measures of mental health, all of the outcomes were positive, and compared them to youth where there was at least 1 negative outcome. And we see this pattern where when fidelity is better, the outcomes were better. A lot of confounds in there, but this is, again, encouraging, one, that wraparound fidelity is important and that the DART can pick up on that. And a couple things that were particularly strongly associated were timely engagement. So really getting in there with the family quickly, getting their needs met, getting a plan established. Saw a really big difference. Saw a really big difference in the START scores, fidelity scores, for those that had timely engagement versus less timely engagement. The other was the key element of being driven by strengths and families. So having plans with really good needs assessments, needs statements being tied to the strategies for that family were the two things that really popped out. But all of the domains were higher scores for the higher fidelity scores when outcomes were positive. So this was really encouraging as well. So let's look at some individual items. I'm going to pause here. Kobe, seeing a lot of things going through. Anyone see any questions that are worth throwing out there at this point?
Yeah, Eric, there are just a couple questions. One regarding when you were looking at the first graph, wanting to know if those differences were statistically significant.
Absolutely. These would be very robust and statistically significant differences between the new state and the established state. Pretty big sample sizes and really big differences.
And then the other question had to do with, since you're looking at two different states, what criteria was used to kind of match the states to know if it was a quote unquote fair comparison?
Yeah, so there's a method in research that makes it sound way more sophisticated than it is. It's called establishing criterion-related validity using a method of known groups. Basically, that means we know, before we ever looked at the data, that this one state is very, very well established, and we know that the other state hasn't even started. So we compared those two, and that's what we found. So, we could probably line up those two states, for example, with our measures of system hospitability, like from our wraparound standards assessment at the system level. And I'm sure we would see much higher scores. We have these data and probably should do that if we want to publicize this further. But if we looked at the degree to which these two states had conditions in place that have been found to be important at a system level, the established state will likely have many, many more criteria met than this new state. So good point, good question. We can do that more systematically using that tool, for example. All right, good questions. So let's look at some things we're learning about wraparound fidelity across the country from the DART items themselves. And this will also give folks a little bit of a sense of what the DART assesses. So we saw that timely engagement seems to be pretty darn important, seems to be associated with outcomes, more even so than anything else. Very interesting. It could be a confound. Maybe the easier families to engage are also the ones that are likely to succeed. But, there's a lot of things that we can do to statistically control. But regardless, we saw that association. How well do folks do? Well, they do pretty well. So this is just a yes, no. Were these timelines achieved or not? And in terms of first contact with the family being achieved within 3 days of referral, over 2/3 of DARTs, that happened. How about first face-to-face contact happening within 10 days of referral? Now we're going down to only about half, okay? Then we look at some of these other benchmarks that the National Wraparound Implementation Center has set for timely engagement, and they fall off even further. So getting the first family story completed within 20 days of the first contact, something important to really get in there and engage, that's only happening about 1/3 of the time. Having the first child and family team meeting within a month of the first contact, only happening about 40% of the time. First plan of care completed within 35 days, that's happening over half of the time. But then having consistent meetings once you get into the implementation phase of wraparound, no gaps of more than 35 days is our criteria on the DART, only happening about 40% of the time. So you can see that some things out there in the field are maybe a little easier to achieve. Some are harder, but it seems as though it's really important to kind of hit these benchmarks. At least, we know that it's important theoretically, but it also seems to be connected to outcomes. So I don't know, Covey, how do you think we came up with these criteria?
Yeah, so it's a wonderful question. I think that when you look at this and we're thinking about best practices in high fidelity wraparound implementation, we were really looking at those timelines. And so those pieces that you're seeing in the red, those do align with best practices. What we may have also done was ensure that there was a slight amount of wiggle room. So ideally, with like a plan of care, we know that after the initial wraparound team meeting, it might take a couple of days to get that typed up and shared out. So you'll see that instead of that being at a 30-day marker, it was bumped to 35. Same with the marker for ongoing meetings. We know that we should be having a meeting a minimum of once every 30 days. Sometimes things happen, so we just wanted to make sure that there was a little bit of wiggle room, and that's why we set the number there at 35. But most of those do align with best practices in wraparound, and hopefully those are the timelines that most of you are aligning with as well.
Well, an interesting comment here that at least one practitioner says it may not be good practice to get the strengths, need, culture discovery, or family story within the first 20 days. Be interesting to have a little bit of the discussion about, what the pros and cons are of kind of formally documenting those things early in the engagement phase. Kim Estep has got a good point here about wait lists. We just really do not want to have that kind of factor in there if possible. Anything else you want to say about that, Kim?
No, I think that's it. I mean, it's just thinking about the intense nature of needs for the young people. I mean, I wrote it in the chat, just making sure that we're being responsive, and that we're matching our sense of urgency to the urgency that families are experiencing. And so that's really, really critical. I see, Eric, we have a hand raised too.
Oh, well, we're not really doing interaction.
I know, yeah.
I don't know. Feel free to put anything you got to say about anything into the chat, and we'll get to it.
Okay.
Hey, Jeanette, it's so great to see you. What seems to be getting in the way of meeting these goals? Well, why don't we just throw it on out there now if y'all want? Same thing probably with whether you have wait lists or not. It's the system, isn't it?
Sometimes, sometimes it is.
I mean, it's the adequacy of the funding that's being provided to wraparound initiatives, the degree to which we have agencies with youth with complex needs working together to figure out how to streamline that access. You're going to have to make the contracts with the provider organizations, make it possible for them to retain their staff so that the waiting lists aren't being driven by a lack of staffing, even if the funding is there. All of these things are really things that leaders at the system level can manage. And, what we experience is that sometimes they're just not really that aware of what some of the impacts are of their policies and funding decisions on the real needs of families, like whether they can be engaged quickly or whether there's wait lists, right?
Yeah, and I think provider type as well, which I don't know. I can't remember, Eric, if you're going to talk about that in this presentation, but I know in past webinars, you all should go take a look as we look at care management entities and the community mental health centers that are doing the work. And there's some differences that we see there too. So.
Yeah, it's a whole nother thread of research we've done that has shown that states that use care management entities where they resource organizations to just do wraparound and to hold contracts with providers, but they're really just they've got dollars that are as flexible as possible to do whatever it takes for their care coordinators to meet the needs of families. Some states have achieved that, including that state that had the highest scores on the DART that we saw earlier, and other states are mostly just contracting as a fee for service with community mental health centers. Fact of the matter is that those decisions make huge differences to timeliness, engagement, wait lists, creativity of plans. And those are all things that can be done differently at the state level.
Yeah, and Eric, I think that there was definitely a resounding yes, there are system challenges. I think some of the other challenges participants have put in the chat are about workforce, oftentimes not having the workforce to be able to staff up so that even when you are receiving more referrals, that you have the individuals who can partner with those families. There's something in there about finding resources in rural areas, outreach to families, and being able to reach families within those timeframes that are outlined, et cetera, and so on. So I think just to mention that above and beyond some of those system pieces, they're talking about some other real life challenges that they're encountering too.
Yeah, right now the National Wraparound Initiative and Innovations Institute are doing a big workforce study. So we've got dozens of organizations and hundreds of practitioners telling us what it is they do at a state and organization level. And then we're hearing from the practitioners on that survey about what the turnover rate is. And we're going to be looking at those factors again. It really, really depends. All of this stuff, we can put it on the backs of our care coordinators, but in the end, the thing that's most likely to get us to good fidelity and these kinds of timeliness, as one example, is going to be around the resources and policies that the system provides to implement wraparound. A lot more available on that at the NWI website. So let's look at just some examples. We're going to get really behind here and never get to the WFI. So keep an eye on the chat, guys, but let's try and get through the rest of the DART findings here. Again, really interesting initial stuff. So now we have item level data from 7 states about the fidelity domains for the DART, the Document Assessment Review Tool, which align with the key elements that NWIC trains and coaches on. So in terms of the driven by strengths and families domain, we see really, partially or fully met in terms of families and youth attending child and family team meetings. But then when you start looking at some of these other items related to being strength and family driven, less than half, far less than half of the DARTs showed ways in which the youth's strengths were connected to the actual strategies in the plan of care. So we see that inventories of strengths are present more than half the time, but whether those strengths are functional and really being leveraged and thought about creatively in terms of how to put strategies together that will do whatever it takes to improve outcomes for the family, those items much less likely to be seen in the DART. We're seeing good long-range visions of a positive future now in a lot of wraparound plans, which is great. So folks are really doing some of the basics of wraparound very well now. It's just these harder things like connecting strengths to strategies that are less likely to happen. Looking at natural and community supports, we're seeing informal strategies. So the plans of care represent a balance between informal and formal strategies. That's happening about 2/3 of the time. But in terms of things like natural supports being present less than 10% of the time, and even when natural supports aren't in family team meetings, we don't see documentation of them being identified and used in the strategies and plans of care. And, I'm an old-fashioned guy, but I just always remember John Vandenberg's kind of story that he would tell in his trainings when he would say, ask people to just close their eyes and think about the biggest crisis or challenge that their family ever experienced. And then envision in your head the person who was most helpful to your family during that crisis. And he would ask folks to raise their hand if that was a professional, like a therapist or a case manager. And then he would say, and for how many people was that person someone that was connected to your family by family, friends, or faith? And 90% of the room went up. We really do. It's a tough thing to do, apparently. But when we can identify those natural supports for families and get them involved, makes huge differences. All right, I am going to really run out of time. So all this is going to be in a report that we put out, and this webinar is also going to be available. We're seeing in the DART, looking at needs-based, folks are getting it. You shouldn't have more than 3 needs statements or it will be overwhelming. You know, we still have folks out there who, you know, use the cans maybe really effectively, but then think that if there's 10 actionable needs, then you have to have 10 needs that you plan around. It's overwhelming. It's not going to get at the deep needs that it really need to be focused on. But the majority of folks in the darts we reviewed are having pretty good need statements, not too many need statements, and strategies connected to the needs, which is great. And we're seeing that some level of progress monitoring in the outcomes-based process section of the DART, there is some type of progress monitoring for half or more of the teams that we reviewed. So again, just a real whirlwind tour of our sections of the DART and some of the things that we're seeing. And we're going to put this into a report because I think we've got enough data now to really have it put out there for folks to help use it to interpret their own data. So Covey and Kim, anything else in the chat before we turn to the WFI-EZ that looked important to talk about?
Lots of things coming up, Eric, lots and lots of things. But I think that it's, you know, keep going. There's no real questions, just lots of chat about, you know, how different states are doing things and different challenges that come up for the care coordinators. Yeah.
I mean, you know, I've been a researcher in academia for 20 years, and it's just way more rewarding to me to have this long-standing conversation using data in the field than to do a research project and move on to the next one. So I love the fact that we've got folks who are this passionate about looking at data, looking at fidelity monitoring, and debating what's really doable out there or what should be done. So thanks for being here. So let's look at the surveys. Caregiver surveys from the Wraparound Fidelity Index. We're going to look, people are really into the national means, it seems like. So we're going to put it out there. I think it's worth it to do so, but also to recognize that, as you'll see, average is not really what we need for families. We need high fidelity. So here's a poll, though. The first thing we're going to do, let's see how much depth of knowledge or good guesses folks have. So if you could launch the poll, what was the name of the first ever fidelity measure for Wraparound? Was it the QAF, the Quality Assessment for Family Fidelity? Was it the TART, the Team Adherence Review Tool? Was it the SPIFFY, the Service Process Inventory for Families and Youth? Or was it the TWIST, the Team Wraparound Integrity Survey Tool? Or are we making all of this up and none of those were actually ever a tool? What do you all think? Got some people really digging in on this one. Some good guesses going on. Well, while you're putting that stuff in there, while you're voting, I'm just going to tell you the right answer is not none of the above. We really had, the very 25 plus years ago, Ted Ty and a colleague created something called the SPIFFY, the Service Process Inventory for Families and Youth. So now you have a little bit of WRAP arcana that you can put into your toolkit there. So let's all, you know, give credit to the SPIFFY as the first tool that our team created way back when I was a grad student at the University of Vermont. All right, so that was a little bit of fun. So what is the WFI-EZ? Someone said it's too long. I agree. We're having a harder time now than 10 years ago getting these completed. It's got about 40 items. The first 4 are about the very basics of wraparound. Do you have a team? Do you have a plan? Does your team meet regularly? That's 4 questions. I think you can, yeah, we can get rid of the poll results there, Brittany, if that's others are not seeing that. Then we have the fidelity section, 25 items. John Olson did a great job doing a factor analysis, and we're going to be applying that to shortening the tool and also making it text-based. But as for now, we have the WFI-EZ. And the third section is satisfaction, 4 items. We'll look at those data. And then there's an outcome section. We're not going to get into that very heavily here, but we ask families as well as care coordinators whether or not this young person has had a new placement or had to be treated in an emergency department, had negative contact with the police. So we have those data available from the report of providers as well as the families. So we have these items across all those sections: fidelity, satisfaction, and outcomes. Chris Vick from our team just did an incredible job going through thousands of records maintained in WrapStat. We're focusing just on surveys collected 2002 or later because we know COVID really changed things. So we're looking at relatively contemporary data. And Chris did a great job filtering out a lot of data. So we have a very good data set from about 33 high-level configuration states or big organizations with 4,500 plus caregivers. We got a lot of data from care coordinators, team members, and youth, but we're not going to look at those today. So one thing, you all know I'm obsessed with this, but when you're looking at the response rates that our collaborators are getting, only about half are getting even better than 30% of the caregivers that are identified, that are sampled, actually collected. And we do think that that has got implications. You really want to make sure you're getting 50% or better so you can have a real representative sample of your families and not just a convenience sample. So we still have a lot to work on, but props to those who are on this side of the scale. And there are organizations that are achieving 50, 60, 70% response rates, which is great. How much does it matter? Well, we're still looking into that. Show you a little peek in a minute. The other thing that's concerning to us is that when they're entering the data into WrapStat, so we've got that the majority of our youth are white, but we got a lot of missing data. So we have data on demographics. Again, from this sample, about 67% white, probably more skewing away from BIPOC families at a higher rate than the real world. But we have this huge missing data problem, so it's hard to know whether or not that's the case. So please complete those variables in WrapStat so that we know how representative our young people are. Because again, we got a third of our sample missing. Same thing with ethnicity, 35% missing. But among those who did complete the ethnicity, our young people were about 20% of Hispanic Latinx ethnicity. About 57% male. And again, missing data on the legal guardian, but for those we have data for, about 75% of our young people in this sample are with one or both birth parents, but we've got a lot of grandparents, aunts and uncles, foster parents also caring for these young people that are in our sample. Okay, so let's take a look at some of the actual data. So one thing just to point out, among our sample, we can look into WrapStat and say, well, what was the percent of these young people who have exited? So if we go up one slide, I'm sorry, I skipped past it. About half of the youth in our Wraparound Fidelity Index sample are still enrolled, but over half are discharged, according to our system. But when it comes to the discharge reason, the exit reason is missing for like 3,600 of our 4,400 youth. So we don't know the most fundamental outcome for the majority of our youth. We really would appreciate it if those who are using WrapStat to collect fidelity data would just do those basic items about your young people in your roster so that we can tie it to fidelity. My sense is that 65% of our sample where we have an exit reason, it's for a positive reason. They stepped down to a lower level of intensity, or they completed their plan of care and discharged. We also have, so that's great, but we don't know whether that's reality because there's so much missing data. Similarly, there's an opportunity that you have to put what was the level of needs met. This is something that National Wraparound Implementation Center says is something you do as part of wraparound practice, is always assess what's the level of progress on those underlying needs that's being made. So we put it into WrapStat, but out of 4,400 kids, we only got this rating for 187. The majority of them showed really good progress, 8, 9s, or 10s on the level of needs met. Then we have a group of 30 where the rating was 0. They probably never really engaged in wraparound. But there's an opportunity there for us to really learn. Okay, so I'll stop complaining. Let's look at the data. The basics of wraparound continue to be achieved according to caregivers. 96, 97% saying they had a team, they developed a plan, the team meets regularly, and they feel like the decisions are being driven by them and their family. So that's encouraging. We're still having the basics of wraparound being achieved. Then if we look at our key elements, remember there's 5 key elements, 5 items for each key element. Profiles of strengths and needs for improvement. I'm gonna, for 4 of the 5 items on the strengths and family driven, fairly strong scores according to the caregivers. Really interesting though to see, and this has really gone down over the years. Sometimes feel like members of my wraparound team do not understand me and my family. I wonder if the move towards more Zoom-based, kind of team meetings and so forth, it's very convenient for families. A lot of families say that they much prefer that to people coming into their homes. But we have seen a real decline in the percent of families, the rate of families saying that they really feel like their team has a deep understanding of their needs. And that's something that is, down on the 0 to 4 scale at, about 2. And so it's something to keep an eye on as an indicator that might be really important to focus on. What about the needs-based key element? Again, there's an item that really pops out. Many caregivers worry the wraparound process will end before their needs have been met. And so how much are we really engaging with our families to understand when transition will occur? Are our systems actually set up to stick with our families until their needs are met? Our caregivers are saying that this may not be the case. Okay, so again, this is just a real whirlwind. We could focus on the strengths too, but just kind of summarizing some trends. Natural supports. We all know how hard this is, with less than half of the caregivers saying they feel like their wraparound team includes friends, neighbors, or extended family members. Families are very generous in their surveys, and this is a very low score. People just don't have natural supports on their teams. And their teams do not include people who are not paid to be there. Effective teamwork. Families are saying, that they feel as though they're able to give feedback at their team meetings. The team came up with creative ideas, but they also feel like, maybe some people who are really important to their services, like their providers, their child welfare representatives and others, are not involved. So that's a finding under effective teamwork, where folks say, I sometimes feel like our team does not include the right people, and there are people who are really critical to my child services who are not on these teams. And then finally, outcomes driven, relatively high scores. But again, the lowest one here is our wraparound team talking about how we'll know it's time to transition was the lowest rated score. So again, our teams really rallying around their families and saying, here's how we know that we're going to stick with you until your needs are met. And here's how we're going to know we're ready to transition. Might not be happening very consistently. And I'm seeing the comments here about respondents getting confused about some of the reverse scored items. Totally agree. Again, we're going to be moving towards a system, and folks are going to buckle up and get ready. If you choose to move to a new approach, they're going to be very brief surveys sent out by text, and we're going to be probably eliminating a little bit of that reverse score things. All right, so now drum roll, we're going to look at the national means that we're seeing and what are some trends. So we got a lot of folks at National Wraparound Implementation Center and our WERT team who say everybody's always asking about the national means. But that worries us because, as we'll see, the national averages on the Wraparound Fidelity Index are far lower than what we see is needed to get to positive outcomes. But anyway, so what do you use to make sense of your WFI-EZ data? Do you compare your scores if you are using these tools? Do you compare them to the benchmarks? Do you even know what the benchmarks are? But do you compare them to the benchmarks that we've set for what high fidelity is? Have you compared your scores to the national means in the past? Have you compared your scores maybe to yourself over time? Like, are we getting better? Forget about anything else. We just compare ourselves to ourselves. Or maybe compare yourself to different sites in your state or organization. So I'm looking at the data here coming in. Looks like folks are mostly comparing their scores to themselves over time, which is great. That's a kind of a plan, do, study, act cycle, right? So let's look at our data from last year, a couple of years ago, and let's improve. So let's compare ourselves to ourselves. But we definitely have a good number of folks who say they've used both the benchmarks that we've set and national mean scores. So that's really useful for us. Thank you for sharing that. And thanks, Brittany, for launching that poll. So a good amount of folks comparing themselves to both national means and benchmarks. So let's look at both of those things. What did we find from these 4,400 Wraparound Fidelity Index tools? Well, our total fidelity was found in this round of analyses to be 70.9. And that is falling even farther short of our benchmark for total fidelity of 80 than in the past years, as we'll see in a second. So here's a comparison between our national means: effective teamwork 64, strengths family driven 77, needs-based 74, natural and community sports always lagging, along with effective teamwork. So we're going to be putting together something that summarizes this, but the big message is going to be, if you're looking for something to benchmark or to kind of compare yourself to, be striving for these benchmarks for high fidelity. These are the scores that have been found in our meta-analysis and other analyses to be associated with the best outcomes for families. So we'll be sending these out and summarizing them. What's interesting is just how much variation there is across our big collaborators. So all of these are 33 organizations that we analyze data from. And you can see that there are folks who are getting to that high fidelity. It is possible. And, you know, as we've done in the past, if we have outcomes data, we're going to say, are those organizations getting better outcomes? Maybe a third. So maybe, you know, like 4 or 5 are getting to high fidelity. About a third are getting to adequate or better fidelity. We got a lot. And then you see where the national mean is. It's down here in the middle. But we've got sites anywhere from total scores of 58 up to 81. So this is just a little bit of a reality check of just how much variation there is out there in the world of our Wraparound Fidelity Index collaborators. Something that we also looked at, how do these total scores, these national means, compare to the last time we did this back in 2017? It's lower for 3 of the 5 key elements of wraparound. We're a little over a point lower for total fidelity than we used to be. And the areas that are lower are teamwork, being strengths and family driven, and natural and community sports. It seems as though we're about the same for being needs-based. So folks are learning how to do need statements, or, you know, are consistently doing need statements and creating plans with a small number of need statements. And outcomes driven, there might be just as much progress monitoring going on. But overall, we're slipping a little bit. We're also seeing an even bigger slippage in mean satisfaction compared to 8 years ago. So satisfaction with wraparound has gone from 85%, giving one of the top 2 responses, down to 82%. Across the board, less satisfaction with progress and with wraparound in general. And the biggest decline, feeling confident about their ability to care for their youth at home in the future. So we've got some work to do folks around really trying to get systems in place to do fidelity to do wraparound in ways that families are feeling good about, and for which fidelity is at that high level that gets to positive outcomes. One last thing, you all know I'm kind of obsessed with how much response rates matter. It is really interesting. We're going to dig in further on this, but sites that had low response rates, middling response rates, and really high response rates, all really clustering around the national mean. So we got a lot more work to do here. My suspicion is that organizations that are getting and sites that are getting low response rates, they may be looking at a subsample of their families that are artificially inflated because they're easy to get a hold of, but maybe that's also being countered by the fact that their organization may not be as effective of an organization overall. So I don't know, it may be canceling each other out. So we've got a lot more analyses to do here, but we are always asking, because we've got folks out there who really are trying to say, what's good enough response rate? What should we set our expectation at? And I want it to be driven by the data. All right, so we are at the top of the hour. Most folks are still with us, so I'm going to ask Kim and Covey to kind of give any other summary thoughts. And if there was any items in the chat, we are happy to have folks stay with us all the way till the 30 minutes past the hour mark. But just a quick summary, the DART is showing validity and sensitivity. It's associated with outcomes, so just further emphasizing how important fidelity is. We have some good data now that we can start looking at DART benchmarks. And DART data show both strengths and areas for improvement that are pretty similar to the caregiver surveys. But the DART also does things that the WFI-EZ doesn't do, like those engagement and are we hitting those milestones? And we saw just how some of those things are happening and some aren't. And so we're going to be putting out a report on all of that now that we have these data analyzed.
Yeah, Eric, there's a few things in the chat.
Yeah, bring it.
I'll have questions, and I was trying to look them up, but you might know off the top of your head. So one of the questions was how natural supports have changed over time per the WFI-EZ, and I think that was also declining.
It is.
Okay, and then there was a question about, do we know if any items correlate with the decline in overall satisfaction?
I'm sorry, which rates are associated?
Well, Becca asked that, and it was with the natural supports declining, which I just found that slide, so that was declining. And then they asked, do we know if any items correlate with the decline in overall satisfaction? So I'm assuming that those two slides that you showed with the
decline in satisfaction,
the essential elements, and then the satisfaction.
Yes. So fidelity has decreased over the last 8 years for both fidelity and satisfaction. So I really think that when families tell us that things aren't working, we got to pay attention. That's one reason that we're going to be moving to putting out there this system that gets that input in just a couple items via text and gets you the data in real time. When it comes to the work that we're doing with the WFI-EZ, I am 100% with you if that was Becca. Let's ask which fidelity items seem to be most correlated with these satisfaction items, including progress, the family feeling like they're making progress. So let's dig in on that. We have so much more to do. I'd love to hear other priorities that people have. So thank you for that.
Well, the next question centered around peer support, and if you know which sites, included peer support as part of their wraparound effort or as part of their state system.
Yeah. So what we've done in the past, when we have gotten good data from our fidelity measures, is to then go to all of the orgs that contributed those data and ask them some questions about how they are actually resourcing their teams and their system and so forth. And so that's 33 high-level collaborators. If we can go in and analyze data about their meeting the standards, including having peer support available, a comprehensive array of services, flexible funds. That's something we can do. The challenge is that we may or may not be able to get that information for every one of our orgs, but we can try. If that is it would be a huge thing for us to do now that we have these data on satisfaction, fidelity, and outcomes to say what seems to be at a system and an organization level, the things that are in place in those places that are getting 80, 81, 79% fidelity compared to those that are down underneath the national average.
Mm-hmm.
And that would include availability of peer support. Unfortunately, there's no item on the WFI-EZ that says, do you have a peer support worker, which would allow us to do that directly. But what's probably more important is what the system of care is offering up to folks. And so looking at the system level would be the way to go, I would think.
Yeah. And the evolution of peer support that I think states more and more have parent peer support as part of the service array and youth peer support as part of the service array. So it's more widely available to families beyond wraparound. Like, kind of gone are the days-ish where it's peer support and wraparound, right? That it's expanded. So that is great that that's happened. And more states have that availability where families can get it without being a part of a wraparound effort or, getting to the level where their needs are so intense. So that's really great.
Yeah, so if you're one of these WFI-EZ licensees and users, thank you so much for being here, for doing this work. And if we come to you with questions about what is your peer support model, there is, as Pat Miles really innovated, decades ago, different ways of doing it. Like Kim was saying, sometimes it's expected that a peer support worker is going to be with the care coordinator from day one. In some places, there's peer support available in the service array. And if the family expresses a need and a desire for that kind of support, then they're brought in. And then other systems, they're not even available. Or maybe they're professionals. So a lot of different flavors that we could dig into now that we have these data.
Absolutely. And there's a lot of questions about SmartWrap. Did you want to talk a little more about that, Eric, and what's to come? People are curious.
Well, we have been waiting to get funding from the National Institute of Health. We got a great score on a grant to take SmartWrap to the final phase of development and make it available. But we're just sitting around waiting for the feds to actually award that grant. We are going to make 2025 the year that is available, though. And so if folks want to actually, I think that we have a couple of WERT team members here. If your organization is interested in being an initial pilot site for SmartWrap, the short message assisted responsive treatment for wraparound. I mean, again, when we see these response rates on the WFI-EZ, we know it's hard. We know people can do it, but we also know it's hard. Folks have identified that it's long, can be arduous. We're going to try and reduce that with SmartWrap. So with SmartWrap, which will be text-based system that gives you real-time data that folks can look at and say, how are my families doing? If you're seeing a family that's struggling from a 2-item text assessment, you go in there and you work with that family immediately. If you're a supervisor, you look at the data and you say, well, it looks like 8 of your 10 families say they're doing great. It's these 2 I'm worried about. Let's talk about them, not the crisis of the week. So that's going to be the idea behind SmartWrap. And I know we've been talking about it for a few years. It's just, we don't have any resource to develop this stuff. So we have to get a grant, unfortunately. So we will take a little note of the folks who are saying your organization or system might be interested in being a pilot site, and we're going to get that started this year. It's just very difficult to get stuff off the ground sometimes.
And also, I believe, Eric, correct me if I'm wrong, there was a webinar on Smart Wrap in January of 2023 that people can go back and they can access that information and see how it all began. And so that might be helpful for folks too. But was there something more recent, do you know, from the January 2023?
Yeah, so there was some in our blog. You can go on the National Wraparound Initiative blog and see some of the 2023 pilot was the very first pilot, very first
Okay.
development grant, where we were developing the items and
Mhm.
seeing how well it worked with just a few families. It was very successful. Now we're going to do a bigger test and probably go ahead and make it available for folks to license for very cheap, just so we can find out how well it works. But again, a lot of this is just resource dependent, just like with doing wraparound. Takes staff, and biggest thing it takes is money for the software developers, which is a thing. So thank you to New York State and Oregon and Washington County and others. We will put you into the kind of roster of folks we're going to reach out to when the time is ready to pilot test this at some scale. And it will be this year. So yeah, this has been great, you guys. So Covey, Kim, other things that you thought about? Why do you think, I don't know, why do you think certain of those key elements are going down and others are not going down? It seems like needs-based and outcome-based are holding steady, but family-driven, strengths-based, some of those things are getting harder for folks, at least from the perspective of families. Any thoughts on that?
I don't know how, Kobe, you feel, but I know that, we can't talk about these things without talking about the staff turnover, right? And so I know we just did a survey around that, and we can't ignore the fact that I think that there could potentially be people in the field who are just not as developed in wraparound. And we do want to acknowledge that we know that that's rough, and trying to, train staff and get them up to speed and so on. But what else would you add, Kobe?
So I think also we need to think about like the system. And we talked about this a little bit earlier. A lot of the conversations that we have with providers also have to do with how, as wraparound moves into this Medicaid funded environment and system requirements are rolled out, including what is billable, what is not billable, we are hearing that in some systems who may not have per member per month rates, more of those fee for service rates, that again, some of those pieces end up falling off. Either they're not deemed quote unquote medically or clinically necessitated, and or they're not reimbursable. And so I think in particular, when I think about the natural informal supports, we hear that a lot, depending on the state or the provider that we're partnering with. So again, I think going back and making sure when we're implementing wraparound, we're really attending to those system level components, because if those pieces aren't set up for wraparound to be implemented well, providers are going to struggle, and therefore the workforce.
Yep. Yeah, it's been a 2-decade journey. And ironically, the more that wraparound's been taken to scale, the more it's been taken to scale with systems feeling as though it can be taken to scale just like any other service. A Medicaid reimbursable 15-minute billable hour fee for service. Wraparound is a system level intervention, and there are ways to do system level financing and oversight, but it's different than other office-based, evidence-based practices. And states that use more innovative methods like per member per month, flexible case rates, and so forth, they have less turnover and they have better fidelity and they have better outcomes. So these are decisions, and there's a continuum. It's not black or white. There's ways in which states can even make some of the more traditional financing methods work for their families, but it's harder. And I think that the movement towards more managed care, in particular for-profit managed care, to do this stuff like all other behavioral health as if it's just another behavioral health service, is probably what's reducing satisfaction and fidelity. Whereas the states, as we saw from the DART scores, that have stuck with that statewide, well-supported care management entity way of doing wraparound, they are getting much more positive outcomes and fidelity for their families. Yes, indeed. It is like a broken record at this point. All right. Well, any other comments or questions that folks saw? I love the interest in the text-based fidelity and outcomes measurement feedback system, SmartWrap. You will get I believe, Brittany, does everyone who registered, do they get a piece of outreach around where the slides will be found, or should we put it into the chat one more time?
It's in the chat. I can copy and paste it and put it in there.
Okay, so feel free to bookmark it. It'll be up there, within a week or two. And as we said, we're also going to be putting out a whole lot of communiques about the national means and benchmarks for the DART. And keep your eyes open. We'll probably do that along with the launch of a refreshed wraparound evaluation and research team, WERT team website. It's been many years since we refreshed it, and we're on the cusp of launching a new version that hopefully will be easier to navigate and have a lot less outdated information. So thanks, Brittany. There's the link to where the webinars live, including one on SmartWrap from a couple years ago. There's one on the DART from a few years ago. There's one on the importance of care management entities and a whole lot of other things.
Yep, go take a peek. Lots of information there for sure.
And we'll also be covering a lot of these ideas at the training institutes in July. If you haven't already been made aware of that huge event, maybe put that link into the chat as well before we finish up. All right. Thanks to everybody for being with us today. And as always, lots more to come. It is a very gratifying thing to be able to be involved in this work with you all for so many years.
Thank you all.
Thank you.